Hey, welcome back, podcast friends. Now, in today's episode, I kind of want to explain this is kind of a confusing topic. So I'm going to try to make it as clear as I can. So I hope I do that. But this is a question that I've been getting asked from a lot of people because as they're starting to do reading and starting to learn about this stuff on their own to see all the other people who are saying the same thing I am, they keep running across terms like insulin resistant and glucose intolerance, and they don't know what's the difference between the two. So, in this podcast, I'm going to try to explain that to you. So, first, what we'll do is we'll talk a little about insulin resistance, what that actually is. And before we can talk about insulin resistance, we have to talk about the muscles because the muscles are one of the biggest consumers and producers of our energy. That our energy, a lot of it comes from our muscles. So our muscles are about 40% of our whole total body weight. 40% of that is muscle for most of us. And the reason this is important is because when we talk about energy, okay, so when we talk about metabolism and energy, what we're talking about is ATP, adenosine triphosphate. That is the energy part that our body uses for energy. So that's ATP. ATP is produced in mitochondria. So mitochondria is that's the organelle inside a cell, and that's the powerhouse of the cell. That's what uses all the energy, most of our energy, and that's also what produces most of our energy. So you want something that has a lot of mitochondria. That's kind of the purpose. The more mitochondria you have, the more energy you will both use and take in, burn. So, mitochondria, when you look at mitochondria, muscle cell has the most mitochondria of any cell in your body. Every single cell in your body has mitochondria except the red blood cell. So, every single cell in your body can produce this energy, but by far, muscles have much more mitochondria than anything else. Now, of the muscles, the heart muscle is by far the most. So, you can think of how much the heart is working constantly. It's always burning, it's always needing energy. So, we've got to be able to give enough energy for the heart. So, the heart muscle has more mitochondria than anything. But then, right behind that is the mitochondria that's in our skeletal muscles, in our brain, and our liver. Those are the most energy using organs that we have. So these are the ones that also tend to have an effect when we start having too much glucose in our body, causing too much insulin to be in there to cause our cells to become insulin resistant. So what happens is when you eat glucose, okay, which is anytime you eat a plant-based food, all plant-based foods are carbohydrates. When you eat carbohydrates, plant-based foods, the basic building block is glucose. When you eat that, your glucose levels goes up. This makes your insulin levels go up. What normally happens is as your insulin levels go up, then that starts affecting your muscles. Your body's trying to figure out what to do with all this blood glucose. So the first thing it does is it goes to your muscles and say, okay, what glucose can you use? And it starts putting all the glucose into the muscle that it needs. Okay. So then not only is it pushing glucose into the muscle, but it's also pushing amino acids from the protein that you ate. It's pushing those amino acids into the muscle also. And this is a good thing because it uses the amino acids, the muscles use the amino acids to produce more protein to build in size. And that's what you want. You want muscles to build in size because the bigger they are, the more mitochondria you have. The more mitochondria you have, the more you can burn the energy that you eat and the more energy you can produce. So it makes you feel better and gives you more energy. But as you start to get older, your muscles start to decrease in the amount. Okay. We start to lose our muscles, both the muscle mass and then the muscles also. And part of this is because of a decrease in testosterone as we get older and also a decrease in growth hormone as we get older. However, just because you're getting older does not mean that you have to lose testosterone. Okay. This is a myth. And if you go back to my episode 121, stop believing these 12 health lies. And these are the lies that companies are teaching to physicians. That's who's being lied to is the physicians. So they don't realize it. And so they pass on this bad information to us about the best way to be healthy because they just aren't, the physicians aren't taught this in school. It's not their fault by any means. But as you get older, you do not have to be losing testosterone. And I talked about that. There are some 80-year-old men who have very good metabolic health. They've eaten healthy, they've worked out their whole lives, they keep their percent body fat down, and they have way more testosterone than some 20-year-old male who is so metabolically unhealthy. They're obese, They don't work, they don't walk, they don't move around. They are the one, they have low testosterone. So as long as you stay healthy, keep your body metabolically fit, low percent body fat, you're moving around all the time, you're gaining your muscles, you're doing resistance training, all that, eating healthy, then you don't have to lose your testosterone. Okay, so that's males. If you're losing your testosterone, look at your nutrition first. Okay, this isn't about taking exogenous testosterone. But anyway, that's one reason why we do. But the biggest reason why you tend to lose muscle mass as you get older is people just quit using their muscles. You know, when you're young, you're lifting these things, you're running, you're playing, you're lifting things all the time. So you're putting your muscles under a stress, which you're supposed to, because as your muscles get stressed, that makes them know, oh, I need to build bigger. I need to build stronger. So if they go under the stress again in the future, my body's going to be ready to take care of that. And that's what you want to do. You want to stress your muscles so you grow the muscles. But if you don't, your muscles will deteriorate. And if you've ever been bedfast in a hospital bed or anything for a long period of time or in a cast, you can see how quickly your muscle mass will decrease. Okay. So it can go down very quickly if you are not eating enough protein, and if you are not walking, if you are not moving it, if you're not lifting heavy things, you will lose your muscle. So that's all you have to do to prevent that is every day, just lift something heavy. And what heavy means, that's totally up to you. It's, you know, what's heavy to one person may not be heavy to another person, but you want to put your muscles under a stress. You want them to feel like, oh my gosh, if this person, your muscles talking to you, if this person is going to be lifting things like that, I'm going to have to get bigger and stronger. And so that's what your muscles do. And that's a good thing. So it's good to put your muscles under stress. Now, as you get older, be careful. Don't put it under a lot of stress. You're not trying to build a lot, and you can actually start hurting yourselves. So just enough to where you're lifting more weights than you normally would. So if you ever have to use it in the future, if you start to fall or somebody around you falls, you've got to pick something up, you're going to be ready to do that. So anyway, that's muscle. So you don't necessarily lose muscle if you are keep you exercising right, keeping your testosterone up, keeping nutritionally fit, and you're always exercising your muscle. You don't have to lose the muscle. And that's really what you want to try to prevent. So the older you get, it's really important to make sure you have good protein intake and also to be lifting heavy things so you can get that muscle growth. But anyway, and that's why, because you may not need it. You may have this muscle on board and you never need it. However, it's just like everything else. It's better to have it and not need it than to need it and not have it. Because if you're in the future and you start to fall and you go to grab for something to catch you and you don't have the muscle strength, you will go on down. And if you do, and you break a bone or something and you're going into the hospital, this is not where you want to be. So you want to make sure that you have the strength on board when you need it. But this is very important because, like I said, muscle, when you have insulin, when you're in good metabolic health, when your insulin levels are high, when you eat a glucose load, that insulin is pushing the glucose and amino acids into your muscle cells to keep you from losing it. And this is a good thing because as you lose muscle, if you start to lose your muscle, that means you're losing your muscle mass. So this also means that you are losing the biggest consumer of glucose that your body has. Okay. So you're losing your skeletal muscle. You're losing your biggest consumer. So what this means is now your glucose level is going to go higher. And as your glucose levels get high, that's going to leave the insulin staying high this long period of time, trying to figure out where to put all that glucose. And then when you do that, it looks around, it can't put it in the muscle cells anymore. So it looks to the next obvious spot, which is the fat cell. So now you have high insulin and high glucose because your muscles aren't using it anymore. So now insulin tells the liver to turn that excess glucose into fatty acids, into triglycerides, into a fat, so it can take it and store that in your fat cells. Okay, so that's what it does. So now your muscles aren't taking it in, so you have to start turning the fat and putting this into the fat cells. And this is where the problem really, really starts getting worse. Because your fat cells, usually the fat cells that you're born with is the number of cells that you have throughout your life. Okay. Except for two different spots. Now there is a small percentage of people that can actually make more fat cells, but the majority, 80 to 90% of the people, they can't. the amount of fat cells they're born with, that's the ones they have for the rest of their lives. And all those fat cells do is they just get bigger and bigger. And these fat cells, they can get up to 10 times their original size. So that's important. Okay. However, what happens is when your body is trying to put all this glucose in your fat cells, okay, so it turns it into triglycerides, pushes that into the fat cells, and you have triglycerides on the inside. When you do this, okay, first, there's 2 times. There are 2 times that your body actually starts producing more fat cells. Okay, not just gets bigger, but they actually produce more. And those are called the 2 Ps. That's for puberty and pregnancy. During these 2 times in somebody's life, okay, as you go through, say, adolescence, through puberty, your body actually will start producing more fat cells. So you have more spots for your body to start storing this energy. Why? Well, just like you would think, it's because it starts because of growth hormone or growth factor that's secreted from the brain during adolescence. And this growth factor, along with insulin, cause these fat cells to multiply. Okay, you get more of them because this is the time that the body is growing. It's growing bigger and it's growing taller. Okay, that's what's happening in adolescence. So the body knows it needs a lot of energy, so it stores that. This is very similar to just like a bear hibernating. That's why before a bear hibernates, it's going to be sleeping in a cave for long periods of time. So it needs a lot of fat on board to get it through that time of hibernation. That's why it goes out and eats all these carbohydrates, all these berries, fruits and berries, because it knows that that's what's putting fat on it. It puts the fat on it, then it goes in and hibernates and just sits there and lives off of its fat. So it's kind of the same thing when you're talking about puberty. It's making all these fat cells, but it's not because you're going through a period of not needing energy. It's because you're using so much energy. Okay. So that's one thing. That's a physiological. Okay. This is the way it is. It's physiological. That's the way it is. It has nothing to do with your nutrition. So you're sitting here and you're making more fat cells because of the growth factor. The other time is pregnancy. And pregnancy also is a time that you need more fat cells. You need more energy because your mammary tissue is growing and you're also helping the baby grow larger as well. So this is another time that your body's going to make more fat cells. And this is also due to a growth factor. And this one is a growth hormone that's secreted from the placenta. So in adolescence, the growth factor is excreted from the brain. During pregnancy, it's excreted from the placenta. And it's called human chorionic somatomamotropin. Just if you're curious. But this is actually time that your body is producing more and more fat cells. Okay. And that's why, because it needs to have more energy for that energy, or more cells to store all the energy that you need during that time period. However, besides those 2 times, all the rest of the time, your fat cells do not gain in number of fat cells. They just gain in size, unless you're that little, 10% of the people who can actually make more fat cells. And I actually talked about that in episode 100, called Obesity Without Diabetes, the Exception to the Rule. That's episode 100. But that kind of will explain this a little bit more about either the cells get bigger, that's called hypertrophy, or they make more fat cells called hyperplasia. And insulin resistance comes from hypertrophy. If you can keep making fat cells, you really don't become insulin resistant because you can keep making fat cells and keep storing fat in there. But in order to get insulin resistance, that's when your fat cells grow and grow and grow. Remember, they can grow up to 10 times their original size. When they get so big they can't grow anymore, that's when your fat cells say, whoa, I can't do this anymore. And it becomes insulin resistant. So now your muscles are insulin resistant, your fat cells are insulin resistant. And this is when you see high insulin levels and high blood glucose. And that is pathologic. That's what you do not want. That is what causes diseases. So what happens is, as these fat cells start to grow, okay, so you have resistance in the muscle now because you're keeping your glucose levels way too high for way too long. So glucose gets turned into fat, stored in the fat cells. The fat cells grow up to 10 times their normal size, and now they can't grow anymore. So there's 2 different things that can happen at this time. One, it becomes insulin resistant, so the insulin doesn't affect it anymore. And so now the insulin, it's not able to push any more fat in, say. And what happens then, and this is important too. This is because there's an enzyme on the inside of a cell, and I've talked about this in episode 34. What determines whether we store fat or burn it for energy? And what that is is there are enzymes. There's an enzyme on the outside of the fat cell and an enzyme on the inside of the fat cell. Insulin stimulates the enzyme on the outside of a fat cell that causes it to push fat into the fat cell. But insulin also inhibits the enzyme on the inside of the cell to make it where the cell cannot break down that fat. And that's the deal. When your insulin levels are high and you're keeping that enzyme suppressed on the inside of a fat cell, then that means the fat cell cannot break down any more fat. And so it grows and grows and grows. And now it says, wait, I'm getting too big. I don't care what the insulin says. I don't care that's trying to break me down. And the cell starts breaking its fat cells down on its own. And the free fatty acids that are inside the cell actually leak out of the stuffed, huge fat cell. It starts leaking out even without insulin. So free fatty acids come out into the blood. So this is important because now, usually when you see fatty acids, free fatty acids in the blood, it's because your insulin levels are low and you're using fat for your energy source. And that's healthy. That's exactly the way we should be. We should have a lot more free fatty acids floating or fat floating around in our blood because we're using it for energy. However, if we see increased free fatty acids in the blood and our insulin levels are high, this is bad. Again, this is pathologic. This means that we have some severe insulin resistance going on. And our fat cells are they're just maxing out. So that's one thing that happens. Our fat cells get so big that it just starts leaking fat. It just starts seeping out of it into the bloodstream. The other thing that happens is as these blood cells get bigger and bigger and bigger, they start swelling away from each other. You could, imagine it having, I'm not even sure what a good example would be. I should have had one lined up. But just think of all these little packed cells, and they're all packed in cells. And each of these cells are getting bigger and bigger and bigger. And as they do, they start moving away from each other. Well, as they move away from each other or move away from the blood supply is what they're doing. The fat cell needs the blood supply because it's producing a lot of hormones. It needs energy. It needs stuff also. So what the fat cells do is they secrete an inflammatory mediator called cytokines. These cytokines, what they do is they affect the blood vessels and increase blood vessel growth. And that makes those blood vessels be able to get all around so it can get to those far sides also. Okay, so it can get those cells that are further away from the blood supply. This is good as far as blood supply growth to get nutrients into the fat cell. But what happens is you get so many fat cells, you're producing so many of these cytokines that are trying to get blood to it that these inflammatory mediators go into the blood and cause inflammation throughout the whole body. So you have high inflammation, high free fatty acids, high insulin. Okay, these are horrible. These are the base for disease. Okay, and then obviously, I won't have to go into it, but if your cells are insulin resistant, that means that your glucose levels are going to be high as well. So all of those are what leads to everything that we know with type 2 diabetes, insulin resistance. Remember, that's what type 2 diabetes is. It's insulin resistance. Okay, so it's high blood glucose is just a symptom of type 2 diabetes. That's not the cause. The cause is keeping your insulin levels high for too long, having inflammation in your body, and now you have these free fatty acids and you have the high glucose. That's what's causing all this. So now that's insulin resistance. And the whole purpose of it is that your fat cells don't want to grow any bigger. Okay, so that is insulin resistance. You have high insulin and you have high glucose and you have high free fatty acids. That's diabetes. Okay, that's what's bad. Now, there's another type of a problem that happens, and this is the difference between insulin resistance and glucose intolerance. Now, like we said, with insulin resistance, these things are high. Your insulin levels are high and your glucose levels are high because you're stuffing so much glucose into those cells that your body doesn't know what else to do with it. Now, there's a difference in glucose intolerance, meaning when you take in a glucose load, when you eat carbohydrates, your blood glucose goes high, and normally you eat it, your glucose goes high, your pancreas produces insulin, and all of a sudden your glucose levels start coming down, and then your insulin levels come down. That's normal. That's physiologic. That's the way our bodies are supposed to. That's the way it's supposed to work when you're eating a good, healthy diet of mainly animal meat, animal fat, and a few vegetables that grow on top of the ground, or depending on where you are in your health. But, just real fruit, real vegetables, real meat. Okay, you're staying away from all the man-made food because that's nothing but toxins. There's nothing nutrient about that. Okay, so that's what normally happens. Now, glucose intolerance means that your glucose levels stay higher than normal. But there's two different reasons. One is because of insulin resistance. So if you eat carbohydrates and your cells aren't responding to insulin, then your insulin and your glucose stays high. However, what you need to know is insulin secretion from the pancreas is called biphasic. It happens in two different phases. The first phase, your pancreas, it holds insulin in it. It's already married. It's ready for insulin. So as soon as your body senses that you're putting a carbohydrate or something in your mouth, your body is already ready. It's got prepared insulin to secrete to be able to handle that glucose load so it can put it wherever it needs, in the muscles or the fat cells or wherever it needs. Now, after that initial, when you eat a glucose load, the pancreas is going to secrete the insulin that it already has prepared in it. And then as it goes, as you continue to eat, or as it assesses where your glucose level is, the pancreas actually starts producing more insulin at that time to be able to control it. And this is good. This is what you want, because if you've got a bunch of insulin and as soon as you eat a carbohydrate load and it dumps all that insulin in your blood, your body doesn't know how much glucose you're getting ready to eat. So it's very possible if you only ate a little bit and had this huge surge of insulin, your blood glucose would go way too low. Okay, that's hypoglycemia, and that's bad too. If your blood levels go low, it could make you die. It can make you pass out. There's lots of things you do not want to have a low blood glucose. This is only a thing that you see with people who eat carbohydrates all the time. You know, when they're trying to mess with their insulins, that's who gets hypoglycemia. You won't get this when you eat a mostly protein meal, a mostly animal meat, animal fat meal with just a little bit of carbs. But anyway, that's a whole nother subject. But now, because the insulin, okay, that's what happens in a normal meal. You eat glucose, eat carbohydrates. First, your pancreas is going to release the insulin that's already stored, and then it's going to assess your glucose load after that, and it'll just make enough insulin to be able to bring your glucose back down to level. Now, a second way, okay, this is for those people who do eat healthy. They do eat lots of protein and fat, and they limit their carbohydrates. Or if a patient is carnivore and they don't eat any carbohydrates, or if you're coming off a fast. All three of those are the same thing. Whether you're coming off a fast, or you're not eating carbohydrates at all, like carnivore, or you're keeping them very low, like keto. When you keep your glucose levels low, you're keeping your insulin levels low. When you are like carnivore or fasting after fast, your body notices that you've been going for like 24 hours without any glucose being put into your blood from what you eat. So your body realizes, I don't need to store all this insulin, okay? Because our bodies are extremely efficient. So it actually breaks down the insulin that it was storing inside, okay? And that's fine unless you eat carbohydrates all of a sudden. So now you've been keeping your insulin levels low. You've been keeping your glucose levels low, so low that your body says, I don't need to keep stored insulin around. I'll just make it when I need it. So now, if that's where you are and you go and you eat a huge carbohydrate meal right after that, or say you're going to go into the doctor and have glucose tolerance tests where they're going to have you drink this glucose solution. When you do that, if your first phase of insulin production has been decreased to where you don't have stored insulin, then obviously when you put that big glucose load into your body, your glucose levels are going to go high and your body's not ready to handle it. But it can. So it has to start revving up. It starts producing the insulin again. There's nothing wrong with it, pancreas. It just didn't need it. So now it starts producing this insulin, and then eventually it makes enough insulin so all of a sudden your glucose level starts coming down again. So that is the difference. That's glucose intolerance, because your glucose is staying elevated, but your insulin levels are low. Okay, there's a difference there. So if you are going to go in for a glucose tolerance test and you eat carnivore, or and you do intermittent fasting, if you're doing this and you know that your body has probably suppressed all its insulin, then you probably ought to start eating just a few carbohydrates, maybe the day before, and get your pancreas to start producing insulin again. So when you go into the doctor and you do a glucose tolerance test, your pancreas has stored up that first phase of insulin again. Because if you don't, and you're good and healthy and your insulin levels are low, glucose levels are low, and you go into the doctor and they give you a glucose tolerance test, they're going to think that you're insulin resistant because your glucose levels are staying too high for too long. But again, it's not because it's resistant. It's just because you haven't been needing it. Okay. But that makes a huge difference depending on who your doctor is, as long as you understand what's going on. Because the last thing you want to do is have a doctor say, oh, you're insulin resistant, and try to put you on a diabetic medication when that's the last thing you need. So insulin resistance is when glucose is high and insulin levels are high. Okay. Glucose intolerance, it can be that. It can be insulin resistance because, again, your glucose staying high, but it also can be this other one where your glucose levels may be high, but your insulin levels are low, and it's just waiting for the pancreas to start producing again. This is also a thing you have to be careful of with intermittent fasting, because if you do intermittent fasting, if you go 24 hours and you don't eat a meal, that'd be enough time for your body to actually start breaking down all the insulin in that first phase. So it doesn't take a whole long time for your body to realize it doesn't need this insulin. It's very, very efficient. So if you go for a long time, if you go for an extended fast over 24 hours, you do not want to break that fast with a bunch of carbohydrates. You want to do it with just a little bit of carbohydrates, just enough to get your pancreas starting to produce that insulin again. Then later, after you think that you've had enough for your next meal, that's when you can introduce more carbohydrates if you want to do that. But that's why you don't want to end a fast with a bunch of carbohydrates. You'd rather do it with a good protein source, fat source, and just a little bit of carbohydrates so you can get that first phase insulin built back up in your pancreas again. So I know it's kind of confusing. I hope that made sense, but there is a difference between insulin resistance and glucose intolerance. Okay. Insulin resistance is just one way you can get glucose intolerance. So the main things I wanted to get from this is keep your muscles going. As you get older, please lift heavy things daily, whatever heavy means to you. Put a stress on your muscles that's going to make sure that as you get older, if you need those muscles for something, they're going to be there ready for you. So you need to be lifting heavy things. That's just always good. You need to be moving all the time. That's awesome. Awesome. Very, very good. The other thing is to realize that you've got to keep your insulin levels low to decrease resistance in your muscles and in your fat cells. And the only way to do that is to keep glucose in your blood low. The only way to do that is quit putting glucose in your mouth, which means plant-based material, plant-based foods, all your fruits, your vegetables. Those are fine depending on which ones they are. And there's some that have a lot more glucose than others. And I've talked about that in past episodes also. But anyway, I'm going to quit rambling right now. That's the main thing. So that's the difference between insulin resistance and glucose intolerance. I hope it made sense for you. If it did not, please contact me. Just send me a message and let me know, and I'll try to explain it a little bit better. But for right now, that's the main thing I wanted to get across to you. And as always, thank you so much for listening. Have a fantastic week. And as always, make simple, healthy choices to live a quality life.